Precision Opinions Live, and my name is Christian, compounding pharmacist at Precision Compounding Pharmacy, and I am here right now with Jennifer McDonald. Jennifer, thank you for coming on. I appreciate it.
Of course.
So, Jennifer, really interesting, You came in, and we were just discussing this. You didn't like compounding at first. Was scared. In school, they play it off like it's a little different. Came on the rotation and started picking it up, and now she's fantastic. Compounds, creams, ointments, suspensions, suppositories, whatever it is, fantastic. So Jennifer works right now at Ocean Chemist, right?
Yes.
And she's here doing her rotation. So Jen, today, I know we spoke about this topic a bunch when we were doing consultations and we were learning with the patients. Testosterone for women is a big question mark. Why are women using testosterone? So today we're going to talk about that and you're going to answer the questions. So why is that?
So actually, it's a common misconception that testosterone is only important in men, but women actually produce 0.1 milligrams of testosterone per day. So that being said, that testosterone that women do produce, it's important for metabolism, libido, and energy levels in women. And especially during a woman's ovulation cycle, testosterone is actually the hormone that's responsible for the increase in libido during that time period.
Day 14, it goes up, just
Yes.
like a camel's back.
Yes, exactly. So that's the reason that, when a woman ovulates, she gets a higher sex drive. And especially during menopause, when hormone levels decrease in women, giving a little bit of testosterone can be beneficial. It will help improve the symptoms of weight gain, decreased sex drive, and fatigue that women will experience in menopause. This can especially help improve their quality of life because a lot of women feel that symptoms of menopause can't be fixed, and so giving a little bit of testosterone is actually beneficial.
Oh, yeah, of course. And they have the symptoms. Their testosterone is less than 5, showing it on their blood report. They could be substituted with bioidentical testosterone. So testosterone comes from a large family of hormones. And I know that you were very interested in that when we were discussing with the patients as far as the conversion and where testosterone comes from. So explain that a little bit.
Of course. So testosterone is actually synthesized from something called pregnenolone. That's kind of the mother hormone. Yes. So basically that hormone turns into every other hormone in the body. And that comes from cholesterol, essentially. Also, testosterone can come from something called DHEA. So that's another way that the body can produce testosterone. And sometimes when people are low on testosterone, you can give them either testosterone itself or you can supplement them with DHEA, which will help with the conversion to testosterone. And once testosterone is synthesized in the body, it can turn into one of two things. Two of two things. It can turn in... Okay, we're going to try that again.
Yeah.
So once testosterone is synthesized, it can turn into two different things. One is called dihydrotestosterone, also known as DHT. And that's kind of known as the bad testosterone. What that does is it causes hair loss, acne, discoloration of skin, and also brittle nails. So when we have too much DHT, we can use a supplement like saw palmetto, which will prevent the conversion of that testosterone to DHT and will help improve the symptoms. And we can also prevent that by using that as well. The other thing that testosterone can turn into is something called estradiol. It's a type of estrogen, which in excess can be bad for the body. So it can lead to acne, a loss of sex drive, constipation, and when levels are exceptionally high, it can be cancerous in areas such as the uterine lining and the breasts. So in that case, we can use something called an aromatase inhibitor, such as inostrozole, and that will prevent the conversion from testosterone to estradiol. And this estradiol also can turn into something called estrone, which this kind of estrogen is a very bad estrogen. It can be very cancerous. So we don't want that accumulating in the body so we can reduce cancer risks.
Exactly. So there's a couple of supplements that are used in bioidentical hormones very often. One being DHEA, because it converts into testosterone, could be used for stress and so on and so forth. Also joints and energy level. But saw palmetto is used very often as well. Estrone can be converted into 4-hydroxyestrone. We know that. It's very, very toxic for the body, so we want to reduce that. And we need to check that too. So looking at a male doesn't want that conversion of testosterone into estrogen. So that's why we use aromatase inhibitors. But and now testosterone, we get it in a yam form. We know that. How do we usually make that and prepare that for patients? And you've made, what, 100, 150 already?
Yes.
How do we usually prepare those?
So they can be compounded into a bunch of different things, like vaginal suppositories, vaginal creams, topical creams that you rub on your arm, lozenges or troches, sublingual tablets, and even capsules.
Exactly. And some of them have better absorptions. I know my favorite is vaginal because the absorption is through the roof. So what's the absorption like of the others?
So, like you said, a vaginal suppository would be, or a vaginal cream would be the best absorption in the body for a person. There is a better blood flow in that area. It will help get into the bloodstream a little bit better and increase the levels a little bit more. And second to those would be like sublingual tablets that goes underneath the tongue, lozenges, then topical creams, and then lastly capsules. And even though capsules don't have that good of bioavailability, it can still serve a purpose in women's health.
Exactly. As far as looking at a patient and evaluating what's going on with testosterone, obviously a topical is very easy, but you may have better absorption when you go vaginally or if you do it sublingually. So maybe trying a topical at first might be better, but in the future, looking at their labs, whether it's saliva or blood, and then switching it to a vaginal preparation, which has almost tenfold absorption. But listen, Jen, thank you so much for coming on. I really appreciate it. Appreciate you at this rotation. You're going to be a great pharmacist in the future. We know that. So thank you for coming on.
Thank you for having me.
Be sure to search Precision Opinions Live on Stitcher, Spotify, YouTube, and Google Pods. And make sure to follow Precision Pharmacy on Instagram, Facebook, and all other social media platforms.